We're all set to go?
Yep.
Okay. What should a woman expect her sex drive to be like in her 40s, 50s, 60s, 70s? What can she do to increase her sex drive?
Oh, she's supposed to have sex drive all her life. Just because we go through changes, we have children, we go through menopause, puberty, all the time that our hormones change. As long as we have a good lifestyle and we're eating well and we go to early to bed, that is, most of us stay up far too long and it messes with our hormones. We don't eat well. We eat a lot of processed food. And if we don't exercise, we're really out of luck. With exercise, everything gets better because you circulate, you get hormones, you make every part of your body work. And, I have an old say that I say, and that's with practice comes perfect. So, like a lot of women haven't had sex for so long that when they meet maybe the person that they've been looking for all their life, that's when they worry because they haven't used their hormones like they should, and they maybe haven't had a good lifestyle. But, that can be helped with bioidentical hormones. Bioidentical hormones will first test you where you're at and then follow you for a certain amount of time every 3 months to see that your hormones are in good shape. And that happens for people that can't get pregnant either. Instead of using synthetic hormones, they use bioavailable. And I would always tell every woman, start early with exercise, diet, go to sleep early, and have a healthy life. That brings everything, and that brings sex life for sure.
What should a woman do to minimize the unpleasant physical and emotional effects of perimenopause and menopause?
Yeah, so women go through menopause many different ways. What I've seen in my life and all the women that come to the Institute, it is from nothing to horrendous. And the more emotional traumas that we've had in our life that actually is unsolved, that brings enormous stress because you realize that your hormones are dropped from here to there. And it's dropped in a way that most women, if they haven't had a good lifestyle, feel lost. It's, am I ever going to have libido again? Am I ever going to have a brain that functions? Am I going to be able to sleep again? So there's so many factors in this. How is my thyroid working? Because thyroid usually plays a big role every time I have a hormone change. And if that's messed up and I didn't feed it enough iodine, selenium, zinc, and good nourishment, and following circadian rhythm, I think everybody needs to realize, start early. For me, the menopause, it was a wonderful time. I feel like I'm just going into the next part, which is now like 16 years ago, but it moved me into the next part of my life. I'm not going to have kids anymore. And you have this freedom and privilege to have intimacy and to just grow in a totally different direction where you're supposed to be the guide.
You wrote a book called Killer Clothes. Mm-hmm. Today, many women wear stretchy pants or spandex pants all the time.
Yeah.
Does this concern you from a health standpoint?
Oh, absolutely. In the 1950s when nylon stockings came in, so many women got all kinds of diseases and even bacteria and yeast infections and even cancer. So, it's just been spiraling after that. So everything I wear is organic. You can have organic sweatpants, organic clothes. When I exercise, it's all organic. And, so our book will show you that the kids that are running around all in polyester, nylon when they're playing soccer, like our kids did too. But we had organic underwear under dose because you still have to fit into the game, and it's unfortunately all polyester and nylon. But we gave this book to one of our previous guests' husband, who is a coach for soccer in Sweden. And he said, I'm going to give it a check. I'm going to give it a test. And he found that everybody had much better results. The success was so much better. So he realized that the skin has frequency. And I put something on the skin that's polyester nylon. You know, it's a totally different frequency. And it irritates and fatigues my skin and my whole body.
If a cancer patient doesn't change anything except their diet and they switch to an ideal diet, what % of the time will they fully recover from stage 3 or stage 4 cancer?
It's all a circle of life.